Welcome to Medicare School Daily. We're excited to be with you here today. We will be answering your questions. We're going to do some Medicare education. We're really just excited to share with you what we've got today. If you are considering taking Social Security while you're still working, this show is for you. We will be talking about kind of the pitfalls that a lot of people go through when they think about, wow, I need to get some money out of Social Security while it still has money. And it's kind of true. The report over the weekend came out by the trustees. Anyway, so if you're thinking about retiring, or you're thinking about continuing to work and take Social Security, there's some pitfalls that you need to be aware of. So we're going to educate you guys all about those today. We're going to take your calls. If you have any Medicare-related question, Social Security-related question, we are here to answer those. The phone number is at the bottom of the screen. If you're watching this on YouTube, if you're listening to us on the podcast, it is 833-824-2004, 833-824-2004. We're here every day from 11 a.m. Central Time to noon Central Time, doing some Medicare education, Social Security education, and answering your calls.
Monday to Thursday.
Monday to Thursday. Yeah, Monday to Thursday. Got to have a day off. This show is brought to you by MedicareSchool.com. We are a team of insurance brokers, right? We are headquartered right outside of Kansas City, Missouri, and our goal is just to help people understand Medicare and then enroll in the plans, compare Advantage plans, supplemental plans, get drug coverage set up, dental plans, anything related to Medicare health insurance. Once you're retiring, we are here to help. I'm going to do one quick housekeeping item. This show is being streamed on the MedicareSchool.com YouTube channel. It is transitioning to its own channel soon. And if you would like to continue watching us, you're going to need to go to MedicareSchoolDaily.com, MedicareSchoolDaily.com. Look for the YouTube icon on that screen. Click on that, and it'll load up the new YouTube channel that this is going to be streaming on, and you can click subscribe. Of course, that's free, but we want you to be able to continue watching this show, and it will be exclusively on that channel shortly. So let's hop into what people need to know if they are going to be taking Social Security while they're still working.
All right, sounds good. Well, first off, let's set the kind of the parameters. And what I'm going to teach has nothing to do with anyone that decides to take their Social Security once they've reached their full retirement age. Okay, so everything that I'm going to share applies only to those before. The majority of people.
What is the full retirement age right now?
Well, right now, most people anyone born in 1960 thereafter has a full retirement age of 67. Okay, and I know there are people that are still working that they were born in 1959. They would have 66 years and 10 months. Okay, but let's just keep it
1958, 66.
66 and 8 months. 1957, 66 and 6 months. Okay. Exactly right. So that's how it goes. Basically, what they started in 1955 birthdays on, they started adding 2 months to everyone's full retirement age up until 1960, and then it's 67 thereafter. Okay. So we'll use that as our example. So I just want to make sure everyone knows if you decide to take, once you hit full retirement age beyond, these rules do not apply. All right, so let's go through it. So first off, of course, we know we can take Social Security as early as 62. So let's just talk about the birth months. Let's say that someone is born today. Let's keep it simple. Let's say they're born July 4th, okay? 1961. Okay. That means they're going to be eligible for Medicare in July, and so their full retirement age then would be July of 2028.
Okay. So I took 61. When they turn 67.
That's exactly
year.
Right.
Or 2 years
2
from
years from
now.
now.
Yeah, 2 years
right.
from now.
So July 4th, 1961 birth date, we're going to be eligible for Medicare this year, but if we want to get to our full retirement age for Social Security purposes, that's going to be July of 2028. Okay. However, we know that we could take Social Security as early as 62. Sure. And so the point is, if my full retirement age is July of 2028, what happens is from the age of 62 up until December of the year before I turn my full retirement age. Okay. So in my example, that would be December 2027. Okay. Make sense? So during that period of time, I can only make very little money. We call that the low earnings test. And so the earnings test means I have working wages, and that's all they're testing. They're not going to test pension income. They're not going to test annuity income, rental income, nothing else but working working wages. So W-2 incomes, 1099 income, salary, things like that. All right. So from the age of 62 up until December of 2027, the numbers this year would be I can only make $24,480, $24,480. Okay. And so for every $2 I make above that amount, then they're going to withhold $1 from my Social Security proceeds. So again, $24,480. Everything above $2 above, they'll take $1 out. So basically, $1 is a penalty. Now, eventually, we're going to get that back, but it's prorated, and so just see it as a penalty. Yeah. And so let's keep it simple. Let's say that someone's Social Security benefit is worth, let's say they're getting $2,000 a month. Okay. And they're above the limit.
That meaning they would get $2,000 at their full retirement.
No, let's just say right now. They
take
because that is the average Social Security benefit right now. It's about $2,000. Okay. So let's say they retire from 62 up until my example, December of 2027, and they're making $2,000 a month. But let's say they're going to be above that by working wages, $12,000. Okay. So for every $2 above, they're going to withhold $1. So I'm above $12,000. That means I'm going to be penalized $6,000
for the year.
That's right, for the year. Okay. So what they will do is if my benefit's $2,000 and my penalty is $6,000, that means they're going to withhold 3 checks before they turn on my Social Security benefits. It's front loaded. Oh, okay. Yeah, it's not prorated. No, it's truly front loaded. So they'll withhold until, and that's why we'll have people say, well, I don't get my first check until April. I don't get my first check until June. Well, obviously they're not yet full retirement age, and they're being impacted by the earnings test.
Okay, so they don't spread it monthly. It's
exactly right. It's front loaded. All right, now, so then here's where it gets a little bit more confusing. Then the year I turn full retirement age, they bump that number up almost 3 times as much, and that number this year is $65,160. So the year I turn. So in my example, we said my full retirement age is July of 2028. I have my low earnings test all the way from 62 up until December of 2027. So that means that then from January through June of 2028, because I'm not yet full retirement age, now I can make more money the year I turn. So $65,160. And then what they do is they withhold for every $3 above, they take $1 out of my check. Okay, makes sense. So let's
say from that January to June they made $95,000.
Okay, exactly right. Well, then they would only be subject then to penalty for that amount above that.
So we're fine. 65 and 95 is $30,000.
Exactly
right.
So
they would have a $10,000 penalty.
That's right. So if they're making $2,000 a month, they would withhold 5 months worth of checks.
So then they would get so they might sign up in June, but they might not get their first check until, what is that, October, November?
Well, we said 5 months, exactly.
July,
right.
August, September, October, November. Yeah, so maybe December.
Right. So the point is the year I turn, they raise that amount up drastically, and the penalty is less as well. Okay.
Is there somebody, because some of this obviously gets confusing, is there, can they go to the Social Security office and they'll kind of workshop this for them, or?
No, really? No. Now, what they can do is they could set up a phone appointment for them to explain it. I think there may be some instruction for them on the Social Security website, but the likelihood of someone explaining these rules just for your average call is probably not very likely, Josh.
Interesting.
Yeah. Now, there are definitely people within the Social Security system that know everything I just shared.
Does the website, when you sign up, does it calculate any of this? Do you have to put in the amount?
No, it will not do that. No, what it will ask you the questions about how much you're going to make,
and it will calculate based upon that.
Yeah, but it won't do it. It won't do it immediately. It'll be assigned to a caseworker, and then the caseworker, when they contact you, would let you know about this.
So they will be contacted by someone.
Yeah, exactly.
If they fall.
Yeah. Now the whole system changed March 7th, and so I'm saying up to this point in time, they have always contacted people. Number one, to verify that it really is them. That's not a fraudulent application.
Yeah, for sure.
But I think they're still doing that. Okay. Anyway, so that's the issue. If I'm gonna keep working. Now here's what happens, and this gets even more confusing. So the year that we decide to, let's say that we decide we're going to go ahead and retire, and let's keep it simple, and let's say we're still within that range where I can only make so much money, the $24,480. So in our example, we've retired sometime before December 2027. Okay. So what happens? Let's say that I decide to retire middle of the year, July, and I've made $100,000 by July. So what happens is clearly I'm above the earnings test. Yeah. But the year that you retire, they will give you the benefit of two different numbers. If you're above the annual amount, then they'll give you the benefit to say, once you start receiving Social Security, we'll look at a monthly amount. And this only happens the year you retire. And so let's say I retire in July, I made $100,000. I'm way above the limit, but that's all right, because then they'll say this, okay, now once you start taking your benefits in July, we'll look at a monthly amount. So they take that $24,480 divided by 12. So this year that's $2,040. So if you're retired and now you're going to make below $2,040 in working wages, there's no penalty. So the year you retire, they either look at the annual amount or they'll look at the monthly amount, whatever is in your best interest. Then, once I've retired, they're not going to look at the monthly amount. It's always going to be annual.
And this would only be for people who obviously are retiring before their full retirement age.
That's right. That's why I kind of opened up with that, because, hey, if we're full retirement age, it doesn't matter.
You make as much money as you want.
Exactly right. Yeah.
Okay.
So I'm of the opinion that if people know they're going to have a penalty and their checks are withheld for 7-8 months or whatever, I wouldn't take. I would just keep waiting. There really is no point. Now, again, they'll get that money back, but it's not lump sum. A lot of people think it's lump sum. No, it's not at all. They'll recalculate your benefit at your full retirement age, and so all that money they set aside, they'll add back to the equation. So then it's their prorated. You just get your benefit goes up a little bit. Oh yeah. So it's not lump sum. If it was lump sum, that'd be cool.
Yeah,
but it's not. Okay. All right. So that's what makes it a little bit confusing. The year you retire.
That's helpful. I feel like I learned.
Okay, good.
How that works a little better, for sure.
Yeah, and anyone, we'll help people with this. We're well-versed in Social Security, and a lot of people will want to start their Medicare at the same time they start Social Security, so we can actually tie that application together. It takes a little longer than a normal A and B application, but we can do that. And we can also do that 1 month earlier, because Social Security applications can be filed 4 months before we want to start our benefits, Medicare 3. But on that fourth month before, if we're approaching 65 or beyond, then they'll ask us the Medicare questions.
It would be interesting to make a tool that people could kind of like use as an estimator. I wonder if such exists, because I feel like these rules are tricky. So maybe we'll work on that.
Yeah.
Release that to our audience. That might be helpful.
Yeah.
I would think it would be.
Yeah, I think it could be a good idea.
Yeah. We can Claude code it. Okay, guys, if you have any Medicare questions, Social Security questions, talk about your specific situation. Maybe you've recently signed up for Social Security and you did or you didn't get a call from a case manager or something. We would love to hear about that. We rely on you guys to tell us kind of what is going on in the present day and age as it relates to your actual experience, and then we learn from that and try to do our best to help everyone else avoid pitfalls or mistakes or just be up to date on the information. So call in. The phone number is 833-824-2004 if you have questions or experiences as it relates to Social Security or Medicare, anything. We'd love to have a chance to chat with you. Let's get to the phones. I think we've got our first caller ready. Hello, welcome to Medicare School Daily. What's your name and where are you calling from?
Hello, sir. My name is Jose, and I'm calling from Kansas.
Jose from Kansas. Well, we're in Kansas as well. Where in Kansas are you?
I'm in Junction City, sir.
Junction City. Okay, well, you're a few hours from us. We're in Overland Park. You heard of that?
Oh, great.
Yeah,
yes, sir.
Yeah, yes, sir. Okay, well, what's your question, sir?
I'm retired Army, and I also receive VA medical, and my birthday's in November, so I know that I need to sign up for Medicaid, Medicare, starting August 1st to make my appointment. But my question is, I know that I have to pay the Medicare $200 and something. Does that happen automatically when I sign up in August, or when I actually start to draw my Social Security retirement?
Sure. Okay. I have one quick question. You said Medicaid and Medicare. Are you going to apply for Medicaid as well, which is...
He's not.
Yeah, I wouldn't think you would.
He won't qualify at all. Yeah.
Well, I'm just clarifying that for him. Are you there, Jose?
Yeah. Yeah, Jose, he's just probably
okay.
A little bit confused.
I just want to clarify, for you and everyone else, you're probably just signing up for Medicare, right? Not Medicaid.
Right.
Yeah, okay.
The Plan B, is that Medicaid?
Yeah, no, it's
No.
all Medicare. So Medicaid is more like lower income assistance, state provided, I think. So
Yeah, lower income, low assets.
yeah, you will just be in Medicare. So yeah, let's get to
Yeah, he's retired military. That's
Yeah,
all
yeah,
I
yeah,
know.
yeah.
It's going to be way above the Medicaid limits. So, and then, hey, Jose, do me a favor. That's one question. Did you have another question or just that one?
Well, that one, and I know I turn in October, I turn TRICARE for life. So do I have to pay the Medicare the moment I sign up in August, or that's only, I start paying it when I draw my Social Security retirement?
Okay, very good. So are you going to start Social Security at the same time?
No. I just want to sign up for
you-
Medicare.
Okay, that's what I thought. Okay, very good. So here's what's going to happen. Number one, if you decide you're going to take your Medicare in November, which is smart, by the way. The only reason you wouldn't is if you're still working. So I'm assuming you're no longer working. Would that be correct?
No, I'm going to continue working.
Okay. Do you have health insurance at work?
No, I have the VA and TRICARE.
Okay, that sounds good. All right, I just want to make sure. So you actually can enroll after July 1 into Medicare. And so once you've done that, because you're not taking Social Security, you're not responsible to start paying for your Medicare until October, until then, but they will send you a direct bill. So anyone that's on Social Security, Part B premium, the amount you mentioned, $202.90, comes out of the Social Security check. But when we're not taking Social Security, I'm the same way. I'm on Medicare, but I don't have Social Security yet. They're going to send you a bill for that. And that bill, just so you know, will be anywhere. The first bill could be 2 months of premium, 3 months, 4 months, or 5 months. And it's basically the lottery. When people self-enroll, you go into the system, and this is happening, thousands of times every day. So they don't want everyone applying today to come do it at the same time. So if someone enrolls, they get a 2-month bill. Next person 3-month. Next person 4-month. Next person 5-month bill. So you're going to get a bill 2 to 5 months. You'll be responsible to pay that. It will be due September 25th. Your Medicare bill is always due on the 25th of the month prior to you beginning coverage. And I would encourage you, just to pay that bill, write a check.
So it'll be somewhere between $202.90 and
over $1,000.
Yeah, about
exactly.
$1,000.
I happen to get a 5-month, but it truly is just the luck of the draw. So you're going to get that. Now, if you don't want to pay that way, then there are other ways to pay beyond just direct bill. You can enroll into a system that is called Medicare Easy Pay. And by the way, if you decide to work with us, we can help you with all this stuff. But if you did it on your own, it's called Medicare Easy Pay. Now, the Medicare Easy Pay system does take a couple of months to get set up. But if you want to pay that way, I would definitely do that. And the way that works, instead of you getting a quarterly bill, you'll get they'll do a bank draft on the 20th of the month prior to coverage. So if your coverage is going to start in October, then they would actually do a bank draft in September, the 20th. All right, so that's the system. Now, I would tell you what I did.
Will that be just for 1 month?
Yeah,
okay.
Medicare Easy Pay is the way to do a bank draft monthly, so people don't have to deal with the direct bills. And that's what I did. I have Medicare Easy Pay. Now, I went ahead and paid my full 5 months because I know it takes them a while to get everything in the system.
So you pay the first bill.
Yeah, I would, but again, you may not have to.
Yeah.
I just did because I didn't want to take a chance because I've heard enough stories. But if cash flow is really tight and you do get a 5-month bill, then you can go ahead and enroll into Medicare Easy Pay, or you actually, when you get the invoice, they'll give you another online option. You could go into your bank account and pay. But I think if it were me, I would write a check and then sign up for Easy Pay, and then you don't have to deal with the monthly Part B premiums. All right, and then of course once you decide to take Social Security, then it's going to come out of your Social Security check. So I'm not done answering your question, but did that one make sense to you, sir?
Yeah, it makes sense. It makes sense.
Okay, sounds good. Now, in regards to TRICARE, it is awesome insurance, very, very good. You served our country, and so they give you TRICARE. But what happens is when TRICARE becomes TRICARE for life, then it moves to the second payer position. Right now, you have VA and TRICARE, which is great, but TRICARE usually is TRICARE Premier, TRICARE Premium, and then it moves to TRICARE for life, effective 10/1 for you. And it's excellent. But you have to enroll in Medicare A and B to have TRICARE in that second payer position. You have to. And I would recommend it anyway. Mm-hmm. Now, when it comes to the VA, remember this. VA is a whole different system. You kind of have the best of both worlds. You can use the VA system if you want, or you can use VA, which pays secondary, and then you can go to any doctor that takes Medicare. But VA will not bill Medicare or TRICARE, and TRICARE and Medicare are not going to pay VA either. Those are totally separate systems. And so, and listen, you could get by with VA only, but I would never do that personally. I wouldn't. I would. You have VA in kind of in your back pocket. Use it when you want. But the best insurance you have available is A and B pays first, then TRICARE pays second. One more thing I want to mention that many veterans are doing today. It's just an option for you. And when you get closer to this, we're happy to tell you more about it. But you have the right to enroll in what is called an MA only plan, Medicare Advantage only. And so what happens with that is you're enrolled in A and B. TRICARE will coordinate with A and B, or TRICARE also will coordinate with the Medicare Advantage plan. So the rules on an MA-only plan would be you have to get your prescriptions using your TRICARE insurance, which is awesome and wonderful. And then your inpatient outpatient side, these are PPO plans, so you can go to anyone that takes Medicare. So your Medicare Advantage plan pays first, and then your TRICARE will pay second. And I will tell you, I doubt you'll have anything out of pocket medically. That's normally the way it goes. So again, Medicare Advantage pays first, TRICARE is going to pay second. Now here's why a lot of people that are TRICARE recipients do that. When you have an MA-only plan, that Medicare Advantage plan is not responsible for any of your medications at all, because you're going to get those through TRICARE. So because of that, they take some of the money they get from the federal government on a monthly basis, and they credit that back to you in the form of a credit towards your Part B premium. So we know your Part B premium right now is $202 a month. A lot of the give-backs right now are in Kansas are between about $120 and $150 a month. So if you have an MA-only plan, that Advantage plan will credit your Part B premium, so you see that come down. So it's only going to cost you about, $70, $80 a month. Yeah, not very much. And so that is a very good option. Now, here's the beautiful thing about that really for you. If you decide down the road, 2, 3, 4, 5 years down the road, you don't like that system, then you can get out of it anytime you want and just go back to original traditional Medicare with your TRICARE being second. All right, so you're not bound to that decision for life. But if I were you, I'd definitely try it. We have lots of veterans, and they don't come off of it. They love that system. And then with that, what you're going to get, Jose, is you're going to get some dental allowance money, vision allowance money, a gym membership. So there's a variety of things. Go ahead, Josh.
What's your zip code, Jose? Okay, we're going to stop for just a minute. I'm going to look up a plan. Are there any questions that have popped up in your mind so far? Because I know my dad has shared a lot.
Shared a lot with you.
Well, I mean, the VA gives me the dental, the vision.
Okay.
I have not tried the gym yet, but I can go to any military gym in any base.
Sure, good.
Around the world.
Yeah.
So, I mean, so that right there is not really going to help me, the MA.
Yeah.
For me particularly.
Yeah, and that's fine. Again, there's some overlap there in benefits, and that's going to happen, but the VA is not going to give you a credit back on your Part B premium. I can assure you that. So that alone, I think, would be very nice. Plus, another thing that it does, it gives you a civilian option. If you just had VA only and nothing beyond that, then you're bound to the VA system. So by enrolling in MA only plan, now you can go to anyone that takes Medicare. There's no cost for that plan whatsoever. So it just gives you something kind of in your back pocket to use whenever you want to, and it reduces your Part B premium. And again, you don't have to do that. You can just stay with what you have, VA and A and B with TRICARE, no problem at all. I just think that there's some benefit.
Most of the Part B reduction, or what they call a give back, is around 125 to 150 a month in his zip code.
Yeah,
so
that sounds good. Yeah, I've got a couple in Wichita right now that I'm kind of aware of, and they have $150 give back. So I know you're not in Wichita, but anyway, so Josh looked them up in your area, and you can think on it. You're not making decisions yet, but when you get closer to it, we get to July 1. If you want some help enrolling into A and B and want to look at some of these options, Jose, we'd be delighted to help you with that.
All right. Well, thank you so much, gentlemen.
Thanks, Jose.
Yeah, good to talk to you.
Yeah.
Let us know if we can help in the future, sir.
You guys have, you have a blessed week, all of you, okay?
Thank you
as well, sir.
Take care. I feel like I learned a lot. That's good. Very cohesive narrative of what somebody needs to do in that situation.
Right. Yeah. What's nice about it, one of the issues that we have with traditional Medicare Advantage plans, if you stay on them more than a year, you if your health is bad, you can't get off of them.
Right.
But that's not the case with him or anyone that is severe.
Just drop it.
That's right. During open
Does he have
enrollment
to
season.
drop that at the end of the year?
Yes. Okay. Yeah. Because once you're you could do it October 15th, December 7th, or OEP first quarter.
So you basically have
you're returning to original Medicare.
Okay.
Yeah.
That's cool. Yeah. I like that. Hopefully that was helpful and clear for Mr. Jose. Let's answer a question. Guys, if you're not in our Facebook group, you can go to into your Facebook app and type in MedicareSchool.com community. And there's, I think, 50 or 60,000 people in there, just like you. We've got a team member or two that are in there answering questions all day, but you can also ask questions and hear feedback on plans or your options or the struggles, the experience other people are having. It's a great resource for helping you feel confident about the choices that you make. So if you're not in there, hop in there and join. Obviously free to do, and I think it's a great resource. I'm going to ask one of the questions we got in there was, I know that Medicare does not cover routine physical examinations. Does the Medigap supplement cover anything?
Mm-hmm. Unfortunately not. And really, I think all of us had to be mindful that Medigap policies follow Medicare.
Yep.
That's what they do. So the only benefit that you get from a MedSup plan that would be not a Medicare benefit would be foreign travel emergency. So the point is, Medicare, it's got to be a Medicare provider, it's got to be a Medicare service, and then your Medigap plan will always pay, no questions asked.
Yeah.
Okay, but so if Medicare will only cover wellness exam, then
Isn't there like an annual something with Medicare?
The first one is called, it's kind of, we call it like a welcome to Medicare physical.
Okay, but that only happens once?
Yeah, but Josh, it is not very extensive.
Did you have yours?
No.
Okay.
No.
Well, you probably should.
Well, I could.
We could talk about it. Yeah.
But I could do it. But the point is, it's what they do is it's checking really body mass, blood pressure, that kind of stuff.
It's just kind of basic.
Very basic. And I think they will give you. There's two other services, and I think they're doing maybe an EKG and something with the eyes possibly. Okay. Just a couple of services, but it's not much. Yep. And I'm sorry I'm blanking right now on what those are, but it is just a little bit extended beyond the wellness visit. But it's still important in that, make sure the doc is up to date. They're going to go through your meds and those kinds of things. So I'm not saying but it's not full blown, draw blood and those kinds of things.
Sure.
If doc during that visit sees something the doctor's concerned about, well, then you're in a position where they can order additional tests, screenings, those kinds of things. So I would encourage people to do it. I haven't done mine yet, but and then after that first year, because that's a special code that only lasts 12 months from your B date. Then after 12 months, then you qualify for just a regular wellness check. Again, even less service, than the first one.
Let's do this, guys. If you're watching this and haven't experienced, maybe you recently had your Welcome to Medicare,
that'd be great.
Wellness or whatever it is, or your annual. We would love to kind of hear about your experience. Did you feel like it was worthless or worthwhile? Was there anything extra that was ordered that got covered by Medicare? Love to hear just stories. Helps us and all of our listeners just make better decisions decisions and feel more confident. So call in, let us know. We would love to chat with you.
Yeah, let's talk about real quickly the foreign travel emergency, because that's the one thing that Medicare will not cover.
Okay.
Remember, Medicare covers this in all 50 states and the U.S. territories.
Okay.
That's it. Puerto Rico, Guam, Virgin Islands, American Samoa, some of those places. I think there's 5 of them. But so if I'm in any of those areas, I'm covered by Medicare, but outside I'm not. So what happens is your primary MedSup plans today, F, G, and N, and a couple of other letters, will give you once-in-a-lifetime benefit of $50,000.
Okay.
I describe it as a kind of a bucket of money that's set aside in your policy that if you ever have a foreign travel emergency issue, you're in, I always talk about one of my clients in Ireland. Was hospitalized on vacation, something happened with her liver, and she was in the hospital 4.5 weeks, $172,000 bill in Ireland. Medicare pays nothing.
Sure.
Her plan paid $50,000. That's it.
Okay.
So it's a benefit that is, the way it works is there's a deductible, $250. And then the insurance company pays 80% of the balance. You pay 20%, but their 80% stops at $50,000. And fortunately, she had travel health insurance. She had $100,000 it paid. But just keep in mind, Medicare, Medigap policies follow Medicare with that one exception. Okay. All right.
That's interesting. So the one thing that Medigap plans cover that Medicare doesn't is foreign travel. If Medicare doesn't pay, Medigap plans is not going to pay.
It will not at all.
Okay. Okay, let's get to another caller. We're ready. Hello, welcome to Medicare School Daily. What's your name and where are you calling from?
Hi, it's Mary from Virginia.
Hi, Mary.
Hello.
What's going on today?
Thank you for taking my call.
Of course. What's your question?
Okay, yes. First, I really wanted to thank you for your show. This is wonderful. I had been watching it, and I had actually talked to a couple of your agents, and they had been very helpful.
Good.
So now, yes, my question is, I have FEHB survivor benefit, and I turned 65 last July, and I kept my FEHB. But now I'm thinking of applying for Part A only and retain my FEHB. So how is that gonna work for me?
Okay, I can. Yeah, is that your only question, Mary? Is that everything you want to know? Okay, very good. First off, what's your date of birth?
1960.
1960. Okay. All right. So right now, you sure you did not enroll in Medicare A already, or because you were eligible.
Sure.
You didn't take A.
Right, I did not.
And you're not working at all, right?
I am working, but I do not have my workplace insurance because I have my FEHB survivor benefit that I'm still using.
Okay, and so you were not automatically enrolled in A only by any other program at all. You have nothing but just FEHB right now.
Correct.
Okay, very good. So first off, you need to enroll into A. There's no cost for it at all. So I would enroll in A, and what they're going to do is they're going to backdate your A date. So today is March, and I would do it today for sure. So 1, 2, 3, 4, 5, 6. So 3, 2, 1, 12, 11, 10, 9. You're going to have a 9/1/2025 A date. And that's which is great. You would have had a 7/1, but the 9/1's fine. So I would enroll into A only. There's no cost for it, so there's no reason to not do that. The only reason people would not take A only is if they're contributing to a health savings account, meaning they or their spouse are still working and they want to keep contributing to an HSA. Then we would discourage people from taking A only. So in your situation, doesn't sound like you have an HSA. So please, today, I would enroll in A. Okay. So what's going to happen now moving forward once you have A is this. Let's say you go to the hospital. Then Medicare A is going to pay first, and your FEHB is going to pay second. Okay, but everything that normally Medicare B would pay, which is basically everything outpatient and all doctor services, all docs, whether it's in or outpatient, the way it will work is your FEHB is going to pay first and you're going to pay second. Okay, so that's what's going to happen if you have A only. Now, I would say to you, unless money is really, 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 really tight, and even then I still would do it probably, but I would encourage you to enroll into Medicare Part B. Now, the problem with you, though, when's the last day you worked? I mean, where you had group coverage? Has it been quite a while?
My own?
Yes, yeah.
Other
than FEHB.
That was like eons ago.
Okay, very good.
I've had FHB for like 40 years.
Okay,
you know?
I understand that. So then, now, did you say you're a widow? Is that correct?
Yes.
Okay.
Yes.
And so, when's your husband pass away?
10 years ago.
Okay. All right. So here's what happens. Down the road, if you decide that you would like to get Medicare B, you can do so. In fact, you can still do so and through tomorrow, and that's it. Because now, when it comes to Part B, you have missed your initial enrollment period. That ended That ended in October of last year. You're not eligible for a special enrollment period, so the only way you can ever pick up Medicare B is using what we call the GEP. It stands for General Enrollment Period, and that's only the first 3 months of the year, which will be over tomorrow for you. Now, doesn't mean you have to do it today or tomorrow. I would if I were you, but if you don't, then next year you can enroll into B. But what's the reason I would encourage you to do it now is because you're still not going to be penalized, because you were eligible for B 7/1 of last year. And so you're after a full 12 months of not taking B when you should have taken B, they're going to assess you a 10% penalty for life. And so almost always, now I'm not saying always, almost always people that don't take B when they have FEHB, yeah, you can get by with it, but almost always people regret that decision, especially if you have any health problems. And this is why. By not having B, everything that Medicare would pay and could pay, FEHB is going to pay, and then you're going to have to pay all the co-insurance. So you have a tremendous amount of responsibility. Or well, let me back up and say, your FEHB. Do you have Blue Cross or Aetna? Who do you have? GEHA?
Oh.
Unfortunately,
I have Kaiser.
Oh, you have Kaiser. Okay, interesting. Okay, well, here's what's going to happen then. So Kaiser's going to pay first, and then you're going to be in the second payer position, which means if you had a serious health issue, what's your max out of pocket? You need to find that out. And that's why I think...
Do you know that?
Yeah.
Like what your maximum out of pocket is?
Let me see. I don't know. I think it's I'm not sure.
And you also said, unfortunately, do you not like how it works?
Well, I was gonna try to switch to another insurance, but I missed the FEHB enrollment period.
Gotcha.
Okay.
How much are you paying for that? Do you know?
Kaiser.
That's another question for Kaiser, because since I used to have family enrollment, like
sure,
self +1, but then it had changed since last month because
you have a child that
my
was on
child,
there.
Yes, on there, and then now she's off there, so it should be only self now. So I need to find out. I think for the family, for the two of us, I was paying like $400 some. So it should. I'm pretty sure it should go down, and that's another thing. I thought it was automatically changed when they dropped her, but it doesn't look like it's the case.
They're still
I
taking.
probably need to.
They're still taking the same amount of premium out of your annuity.
I think so. Yeah.
Okay.
Yeah.
Okay.
It hasn't changed.
Well, for sure.
So is that the usual process? Do they wait for me to?
Well,
tell them to
I
change
would
it?
think it would be automatic since it's been canceled, but obviously they haven't done so. Just give them a call. You can get in today and make sure. But back to your question, definitely do A only. I would encourage you to think through the B part, because if you had the B, it's going to cost you $200 a month, $202.90. But Medicare is going to be in the first payer position, so your Kaiser will probably pick up the balance, or at least close to that. But if you wait, just know you're going to be penalized down the road. So think about it right now. Anyone that went without 12 full months.
So if I took Part A only, you're saying that Kaiser will be in the second payer position
for anything in the hospital side. So if you ever go to the hospital, Kaiser second. You go to skilled nursing facility, Kaiser second. Hospice, all those things that are covered by A, Medicare pays first, Kaiser pays second. Everything covered on the B, since you don't have B, then Kaiser pays first and you pay second.
Oh, and the B are like the doctors?
Yeah, all doctors.
Anything
Right.
outpatient.
Oh yeah, any kind of doc.
Okay.
And I think what my dad is saying is the kind of window for you to get Part B
Without penalty.
closes tomorrow without penalty. And this is, I mean, literally, if you enroll next year, she would have gone 12 months without coverage,
right.
so she will have a 10% penalty for the rest of your life.
For
so,
life, exactly.
yeah, it's kind of interesting. You've got about a day. Now, how does she decide what to do? This can all be pretty overwhelming, I would think.
Yeah. Well, I think I think it comes down to is your money real tight, income wise?
Well, yes, and that's it's kind of tight right now. And then I'm also considering retiring, sometime this year and take Social Security. So then I'm not really sure how my finances are going to look like if I do that. That's why I'm hesitating to make a big change right now.
Sure. Well, if you ever had a serious health event, you would be thrilled that you had Medicare B. I can tell you that. So if finances are real tight, what you could do is you could. Of course, I don't know. We don't know what your B cost. I mean, we don't know what your
FEHB costs.
Yeah, we're not sure about that. So it's difficult for me to tell exactly what I would do. But I think your premium is probably going to be $200 to $250. So it may be in your best interest to enroll in B after you've talked to Kaiser to see exactly how they would coordinate with Medicare. I think it's worth your while to do that before tomorrow or by tomorrow. Ask them. So if I did take A and B, because here's why I'm asking. I'm telling you this, because if you had Fed Blue or if you had GEHA right now, they're giving their recipients who enroll in B an $800 a year credit to offset some of the B expense. So now that $202.90 just dropped another $70 a month. And so you need to find out how Kaiser, are they giving it credit? Yeah, well, they give you credit for you enrolling in B, because that puts them in the second payer position on everything, and so it's in their best interest that you do that. But again, if they give you credit, I like that for you. Okay, it also avoids a lifetime penalty. So that's at least I would do that. Okay.
Do you know what the name is of the plan that you're in as it relates to
the Kaiser?
Kaiser?
Oh, no, I don't know really, but because I always just called it Kaiser, I'm not sure.
Sure.
What is your zip code?
They have different. Oh, okay.
What's your zip code?
Do they have different plans?
Did you get it, Josh?
What was your zip code again?
Okay. Well, that's the things you need to find out. Number one, what's it cost you to stay on Kaiser? If you did take A and B, how will they coordinate that? I know Medicare pays first. What are they going to be in the second payer position? Will they cover everything? Or if you did A and B, would they put you on one of their Advantage plans? That'd be nice to know that.
Yeah, I think they do have Advantage plans.
Yeah, they do.
And it says
they are on. Yes, you're
Okay.
right. They're on Advantage plan, but like I said, I'm planning to change companies next
Makes
year.
sense.
Yeah, I understand. Okay. Now, I'll just go ahead. You want to say something? Okay. I was going to say just one more thing, and we got to get to other callers here. But another thing that I have had clients do in the past, again, just an option, and that would be they enroll in A and B, and then they make the decision to go ahead and suspend, not terminate, but you can suspend FEHB. You don't have to pay for it any longer, and then you can just take a traditional Medicare Advantage plan on the regular market. Okay, and there's lots of those in California, and so if I were you, I would seriously, consider that as well. That'd be something that you could do. And if you took B, we still have plenty of time to do that. All right. Yeah.
So the decision really is: should you take? Definitely going to take A.
Plenty of time to do B.
Well, because
so
once
A is like today.
Yeah, I would. Well, actually, and B for you now is by tomorrow. Yeah. So that's really what you have to decide.
And it's the same application.
Yeah.
You do it online, SSA.gov, and you apply for Medicare. It's a very simple thing. We can call in. We can walk you through.
You
it.
have so many options if you'll go ahead and sign up for B. It's $202.90 a month, and it's not a waste of money. It's not like you're you really.
And we don't make any money off telling you to do that. Just so we're clear.
No, we talk. Talk to you again.
Yeah.
But if I took B, I would probably need to get the supplemental plans too.
No, not necessarily. Oh. You really no. I would look at the Kaiser options. We could look at normal Medicare Advantage options. But you see, you can't do if you don't have B. You're really your hands are tied. You cannot do much at all. In the Medicare space. Yeah. So that's why I'm saying, I promise you, you're my sister, and I'd be your bigger brother by just a few months, just so you know. I turned 65. I turned in January. So if you were my little sister, I would beg you to get on B, because long term you're not going to regret that. You're just not going to. Okay. It's not a waste of money for you.
Okay, Mary, we got some other calls we got
nice
to
to
get
talk
to.
to you.
Thank you.
Okay.
So nice to chat with you.
Well, thank you so much for what you do. Thank you.
Take care.
Bye-bye.
Thanks. Bye-bye.
Hello, my name is Patty, and I'm calling from Pittsburgh.
Hi, Patty from Pittsburgh. What can we do for you?
I have a couple of questions. I am currently on Social Security disability. I've been since 2021. I got COVID, and I can no longer work.
Wow.
And now, when I went on SocialSecurity.gov to get my taxes and all my stuff ready to go, it had Social Security, but in parentheses it says disability.
Yeah.
Mm-hmm. And then I get a survivor's benefit also.
Okay.
My question to you is, since it says disability on it, I'm looking for a little part-time job. I want, just for something to do to get out of the house. Mm-hmm. And I don't want to get a job if it's going to, mess up my disability.
Mm-hmm. Mm-hmm.
Okay. How old are you? Did you mention that?
Yeah.
I'll be 65 in June. I was born June of 61.
Okay.
I got disabled in 21.
Okay. Just if you don't mind, Google real quickly. Disability income limits.
Earnings.
Yeah. It's called substantial earnings. Josh is going to look that up because I think it's like I'm going to say 18 grand. How much is it?
$16.90 per month.
$16.90 per month. Okay.
Yeah.
So as long as
you're not blind, are you?
No.
Okay.
Okay. Yeah. So as long as you keep your wages below $1,690 a month, it should have no impact on your Social Security disability checks at all. Okay.
Okay.
Yeah. So also, what's going to happen? So hang on just a second. So I'm assuming you must have just gotten your Medicare card. It showed up probably in February. Is that correct? Your A and B card?
Well,
I got that in 22, I think.
Yeah, she's been on disability since.
I'm on disability, so I think I got it in March.
My bad. You're exactly right. Okay, my bad. Anyway, so the point is, you can keep working as long as you don't go above their limit. Josh just Googled that just to look at it. So $16.90, stay below that. So the reason it says disability is because that's where that's the trust fund that your check is coming out of. Once you hit your full retirement age, which will be you said your birthday is in June, so June of 2028, then it will just be normal Social Security. The check amount's going to be the same, but once you hit full retirement age, they just simply bring that out of a different trust fund. That's all that means. Okay? Now, also, yes, so
Jeopardizing.
yeah, and you won't stay below the 1690, and you can always Google that amount. It goes up a little bit every year, so just stay below it, and you're fine.
Should we mention, since she's turning 65? Yeah, let's talk about that.
All right, so
this is very important. Patty, this next little part.
What's going to happen now? Do you have a supplemental plan right now, or an advantage plan for your A and B, or either?
I have supplemental. I have I have the red, white, and blue card, and I have a supplemental of Aetna insurance, and I have the Plan D drug.
Okay, now on
plan.
your supplemental plan, is that a G plan or an N plan on Aetna?
N plan.
I'm sorry, N?
N, yes.
Okay, very good. Josh, run that up. So when it comes, what's your zip code in Pittsburgh?
15229.
All right. So what happens is beginning June, of course, you'll be 65, and so you have the right to kind of reset the clock, your Medicare clock, just to see if there may be something better for you. You can get a G or another N, and we'll just see what the price is. Do you know what you're paying right now on that N plan with Aetna?
Yeah, it's it's $122.
Okay, that's pretty good premium. Okay, but let's see what the market is right now, and you can keep that, but you also get to reset the clock. Sometimes states allow the insurance companies to charge more for people that are on disability, and so I don't know if they did or did not do that in Pennsylvania. But Josh is going to look it up.
Paying?
122.
Yeah, we can get from a reputable carrier that you would know of.
We can't mention it online.
Yeah, like you would absolutely know this exact insurance carrier. We can get you down to like 89, 87. It looks like, so save about $30 a month.
Yeah, same end plan, 89, 87. So
because I think with Aetna, you're paying 122.37. Does that sound right?
Yeah, that's what it is. That's exactly what I'm paying.
Good. Yeah. And you can do this without medical qualifying because Medicare. See, what happened when you first got on disability, you had your initial enrollment period. Now this is called the IEP2. So you'll be 65, so they allow you to get a different plan. Because frankly, in some states, people can't even get MedSup plans, but obviously Virginia allows that. But Aetna again got to charge you a little extra because you're on disability, and so now you can just get a standard in plan of any carrier, no underwriting, and you're going to get the normal 65-year-old rate. It's not been rated up.
We tell everybody to. Try to switch your supplement plan if you can, every 3, 4, 5 years anyway, because you get into a block of business with newer, younger, presumably healthier people, right? And so it's always a good idea, and you have an opportunity where you can do this without any medical underwriting.
Right.
So,
So I would just call your office and get this changed for,
yes, ma'am.
for Pittsburgh?
Absolutely. Let Josh give you the number, and you call in and just ask for an agent, and they'll transfer you to an agent that we know and we've trained. So we're happy to help you with this.
Yeah, I listen to you all the time.
Oh, okay.
You're very helpful.
Good.
And I know it's like Social Security, whatever I make, I get like 22, whatever, a month.
Sure.
Now, I'm going to start in July collecting a pension.
Okay.
Does that have anything to do, any bearings, like with me working with Social Security?
No. The only bearing on that pension is, it's going to affect your overall income, which means you have to pay, probably some extra taxes or something, but there's no impact at all.
How much is it?
644.
Okay.
Yeah. There'd be not really any impact. No impact at all. Yeah, because that pension income will not count against your limit on your wages for your Social Security disability.
Because I even asked them, my tax people, if I should be taking taxes. People, they tell me they take taxes out of Social Security and they take taxes out of their pension. And when I talk to my tax guy, he says you don't have to take taxes out on that. And I'm like, well, I don't want to owe.
Well, do you owe taxes generally every April?
I haven't the past couple of years.
Yeah,
no, but I haven't. I'm starting to collect my pension July 1st.
Yeah, I
So
mean,
that's another.
if
Yeah,
you
another
want to,
600. Well, yeah, if you, it's going to be minimal. I mean, it would be minimal. They have an.
yeah, if you wanted to set aside in a separate savings account, $75, $100 a month, and then see how it goes.
Right.
You know, see how next April how that impacts. It probably won't impact anything. Or just ask your accountant, say I'm going to get an extra $650 a month. Basically,
Yeah.
do I need to set anything
Yeah, I don't-
aside?
yeah, I
He'll
don't-
be able to probably pretty quickly tell you.
Absolutely.
Yeah.
I'm gonna give
Okay,
you our
well,
I'm gonna give you our phone number, okay, for the office, not the phone to call in, but just the phone to call into one of our agents and talk to them
Okay.
about this other supplement plan. The phone number is 833-3661. So 833-3661.
And just tell them that I wanted to change my plan.
Yeah.
just
Just tell them Marvin and Josh told you to call in and change your supplement plan because you're on disability, turning 65 in a couple of months, and they'll know exactly what to do.
Exactly right. Get you another
right,
in
thank
plan, and now let me share this with you. That Aetna plan. Once we get everything set up, you're going to call them sometime during the month of May and cancel that policy. We can't cancel your Aetna plan for you. You'll have to do that, but we're not going to do it yet. But once we get everything set up for that new plan to go into effect 6/1, we don't want to have an overlap. So you'd call in sometime in May and just cancel it, no problem at all. Okay.
All right. Thank you very much.
Take care.
Well, you're welcome.
Have a good day.
Yes, great to talk
Bye-bye.
to you. Bye.
Hello, welcome to Medicare School Daily. What's your name? Where are you calling from?
Hi. My name is Leroy Fogel. I'm calling from California. Is this Josh?
This is Josh. My dad Marvin's here as well, so we're both listening to you. What's your
Cool.
What's your question, sir?
Yeah, I have two questions. Maybe you can help me. One's on Social Security, and the other one, of course, is a Medicare. Medicare, I'm 64 now, and I won't be turning 65 until next February. I am covered. I am a disabled veteran, so I am covered under the VA as well. I've been watching your father on his show, and he says, when you have another type of insurance, you should probably go with a Medicare Advantage plan. Okay. So I've been kind of thinking about that, and I'm probably going to call you guys when I get ready to do that. But how soon should I start preparing to do that? Like I said, I turn 65 in February, so next February.
Yeah, any time about 90 days in advance is a good time period, but I'm going to tell you a little tip. So I would wait until after the December 7th deadline passes. So what's going to happen this fall is because you're becoming eligible for Medicare, you're going to start paying attention to this stuff a lot more probably. And so from October 15th to December the 7th, there is the time when everyone who's currently on a Medicare Advantage plan or on a Medicare drug plan, this is their opportunity to switch those plans for the year. So everyone is bogged down. The system is slow. You don't really get a lot of time with anyone because there's 70 million people on Medicare that are trying to make changes. So my suggestion to you would be realize, number one, that December 7th deadline doesn't apply to you. Okay, so do it after December 7th. Whenever it's just you're going to have better attention from anybody that you talk to. The system's not going to be bogged down anymore. So that's the first thing I would say. Now, I'm going to let my dad. Just wait till the crunch time is over. Doesn't apply to you. Now, in terms of applying for Medicare, do you get a Social Security check right now?
Yes, I did. I started taking Social Security when I turned 63.
Okay, so you are going to automatically get your Medicare card when, Dad?
About October 15th to the 20th.
So sometime in October, you're going to get a Medicare card mailed to you automatically. It'll have Part A and it'll have Part B, and it'll have your Medicare number. I would say when that comes in, don't do anything until after December 7th. And then get in touch with us if you want to use us, and we'll be able to say, okay, here's the 2027 plans, that are available. We can help you compare all those options. So I'll shut up for a minute. What questions do you have so far?
No, that answers it pretty good for the Medicare part, I was just, there's so much stuff out there. I watch your dad, and I've seen you on the channel a couple of times, but I watch your dad religiously whenever I can, and that's why I know that. He says, well, if you're already covered in the VA, you should probably look at a Medicare Advantage plan, even though, he doesn't Medicare Advantage plans aren't the best, but I'm really happy with my VA. They
good.
take really good care of me. So
Hey, Leroy,
yeah,
one quick
so it makes sense.
Leroy, one quick question: is your birthday? Is it during February? Is it February 1st or after February 1?
No, it's after. It's
Okay, very good. So, yeah, and I would agree with Josh. What you can do if you want to use our company, you can always call in, when that Medicare card comes, and we can get you an appointment on the calendar for sometime in December, for sure.
December 10th, 11th, 12th, mid-month.
You still have plenty of time to do that. And then one of the nice things, too, then all the plans will be out, and we'll know what's going on for 2027. And then hopefully, and I think this will happen with those MA-only plans this year, we're seeing the Part B give-backs in the neighborhood of about $120 a month, $150 a month. So I think they'll still be very favorable, so that will really pull down that Part B premium for you. Those are MA only. Of course, you got to remember, you got to get your meds through the VA system, because that's why those insurance companies get to give you that money back, because they're no longer responsible for your medications. But again, you'll be happy with it. So I think an MA only plan is a really, really good option for you. And so we'll help you when you're ready. But just give us a call. The card's coming around the 15th.
And you have, you said you had a Social Security question as well?
Yeah, I do. Hopefully you guys can give me advice on this. So because I'm already registered and I'm taking Medicare, or not Medicare, Social Security, my wife is still way off. She's younger than me. Now she got a sizable inheritance, and it's in her name right now in a bank account, and we wanted to start a joint account and have that money transferred over. Now, I see so many things about Social Security, about putting money into accounts in your name. And now, is that something that I have to worry about? Will I be penalized for it or something like that? Because it shows now I have all this money in an account that's got my name on it.
No, the only way that would ever hurt someone is if they were going to try to apply for Medicaid, because the state Medicaid is going to look at assets. But now it has no implication at all for Social Security, nothing. Now, of course, if you'll invest in it and you start making money, then, your returns, the interest you earn, or, capital gains you get on investments, then that's going to, of course, affect your income. But that's a good thing. That's not a bad thing whatsoever. So assets only hurt you when it comes to Medicaid eligibility.
Yeah, because Social Security is looking at income.
Yeah.
Earned income, wages.
Yeah.
That sort of stuff.
Oh, okay.
Yeah. So it's...
I see. Okay, good.
Yeah.
that answers that.
Yeah.
It just got me a little worried, and I was like, oh, man.
Now let's talk about it.
I see all these horror stories.
Okay, so now listen, if you start making, because your birthday there, so you don't have a full retirement age until 2/1 of 2029. So when it comes to, of course, that's not. No, I'm just trying to think if there's any implication whatsoever.
I mean, are you? The only thing could be like an IRMA if the. Or is that's only earned income as well?
Well, no,
right?
that's everything.
Okay,
Irma
so
would be everything,
let's say this inheritance was $20 million and he's making $2 million a year. That would have
and Josh is right. If right now in the present day, if you were above $218,000 in modified adjusted gross income, that'd be you and your wife together above 218, then you could have a slight surcharge on your Medicare B. That'd be the only implication. So, depending on how much it is,
but that's household anyway. By you putting it in a joint account, that's not going to change that anyway.
I wouldn't. I'm not. I wouldn't discourage you for a second from doing that at all, because it's not. Yeah, it's not earned income at all. It's just an asset.
Okay.
So you're fine,
good.
sir.
Yeah. So
yeah.
That had me worried for a second, but I think you guys have answered that quite well for me. Okay. I appreciate it. Well, thank you very much. Those are the only two questions I had.
Hey, do you have our office phone? Do you have our office phone number? I can give it to you.
Yeah, that's the one I seen it on there. It's 833-833, and then it's
3661.
Something like that.
3661.
Yeah, I have that number.
Good. Well, we'll look forward to hearing from you.
As soon as I get that Medicare card, I will call you guys.
Call and get on the schedule. That'll be great. Okay.
All right.
Thanks, Leroy. Take care.
All right.
Have a good day.
Thank you, gentlemen.
Nice
appreciate
to talk to you, sir. Bye.
Bye-bye.
Okay, guys. Hey, join us tomorrow for another episode. If you are thinking about selling your house, which a lot of people do as they retire, maybe downsize, or I don't know, feel like people retire and upgrade somehow. and you're wondering, like, how does all of that affect my Social Security? How does it affect my Medicare premiums? Because it can. We're going to talk about that tomorrow. Yep. So if you're thinking about making a house change and you've got some equity built up in that, how does that affect your Social Security and your Medicare? We're going to talk about that on tomorrow's show. If you want to be a part of the show, call in 833-824-2004, 833-824-2004. If you need help with Medicare planning, whether that's Social Security or whether that's signing up for a supplement plan, signing up for a Medicare Advantage plan, getting drug coverage set up,
A and B setup,
whatever it is as it relates to Medicare, we've got a team of people outside these studio doors, come to work every day wanting to help people understand their Medicare options and help get them enrolled. When you work with our company, you're assigned a dedicated client care manager. This is somebody who really just walks with you through all the changes that life happens, whether you move, a plan drops, you lose your card, you need a new card, you have a billing issue, you need somebody on your side. When you work with us, you've always got somebody on your side. You don't just have a faceless 800 number calling a call center for an insurance company on the other side of the world. You've got somebody in your corner. Our office is in right outside of Kansas City, Missouri, in Overland Park, Kansas, and we'd love to serve as your broker. Our costs are free. There's no surcharge for the insurance or anything. We're just insurance brokers. We're paid by insurance carriers when we help you enroll into a plan. So we'd love to assist you if we can. Anything you want to add?
Nope.
Okay.
Excellent.
Well, we will see you on tomorrow's episode. Thanks, guys.
Okay.